Hi madam, my name is Rosyni from Cohort 5 and today I want to explain about my poster and my poster's topic is atopic dermatitis among adults. Okay, what is atopic dermatitis? Atopic dermatitis is a chronic relapsing pruritic type of inflammatory skin disorder. Atopic also refers to asthma, allergic rhinitis, and atopic dermatitis. Atopic dermatitis affected 2.1 to 4.9% of adults. And now I will tell about the risk factor present for atopic eczema disorder among adults. The first risk factor is family history. It's because atopic dermatitis can persistent patterns. It may be useful to access information on patterns of disease among their family members. The second risk factor is elevate the immunoglobulin E level, and the third is depressed cell-mediated immunity. The last risk factor is increased histamine sensitivity. The increased release of histamine from basophil leukocytes of atopic patients has been described, as well as elevated histamine levels in plasma and skin during acute exacerbations. I will continue with signs and symptoms of atopic eczema disorder among adults. The sign and symptoms is dry skin, itchy skin, red rashes, swelling, crusting skin, and a small bump on our skin. Okay, now we will see the type of eczema disorder among adults, and there is many eczema disorder among adults, that is atopic dermatitis, contact dermatitis, neurodermatitis, seborrheic dermatitis, dihydrotic dermatitis, occupational dermatitis, and nodular dermatitis. And from this list I have choose atopic dermatitis among adults. Okay, I have choose atopic dermatitis from the list because adults also tend to get atopic dermatitis on different parts of their bodies than to the children. So in adult, the skin tend to be extremely dry and scaly, where the atopic dermatitis appears on adults. Okay, the another reason why adults get atopic dermatitis is because of exposure to allergens such as pollen, and also by stress and dry skins, and also in infections. So that's why atopic dermatitis affect among adults. Okay, there are few recommendations of treatments for atopic eczema disorder among adults. The recommendation treatments are use moisturizer cream twice daily. It's because dry skin can make our eczema worse. So moisturizer lock in water and create a barrier against things that can irritate our skins. For example, we can use moisturizer cream such as Caterpillar. Next recommendation is take a warm water shower. Take at least twice a day. Shower in warm water at least 10 to 15 minutes. Take in note, avoid scrubbing while bathed. Okay, the third recommendation is use corticosteroid cream. It's because corticosteroid creams can treat skin conditions such as rashes, eczema, itching, and dermatitis. Corticosteroid cream also have potent anti-inflammatory actions and also suppress the immune response. For examples, we can use Fusibat and Dermovate creams. The next recommend is use a humidifier. It's because hot and dry indoor air can patch sensitive skin and worsen the itching and flaking on our skin. More than that, apply anti-itch cream on affected area. Anti-itch cream helps to relieve itching and pain that caused by atopic eczema. For example of anti-itch cream is Benadryl cream. The final recommended treatment for atopic eczema disorder is wearing a cool, smooth texture clothes. It's because smooth clothes can reduce irritant, and also wear appropriate clothing in hot weather or during exercise to prevent excessive sweatings. And now I will continue on giving counseling for atopic eczema patients. Atopic eczema patients should avoid moisturizers and skin products that made with perfume, extra ingredients and preservatives. Atopic eczema patients also should avoid getting hot and sweaty. It's because heat can stimulate that itchy and prickly feeling. Next, atopic eczema patients that experience a lot of stress should take psychological counseling or even taking anxiety drugs. More than that, atopic eczema patients should wear gloves when their hands are exposed to water or irritant or cold temperature. More than that, patients also could moisturize their hands to prevent dryness. The last part is guidance on using atopic eczema products. The first product is Benadryl cream. Before applying Benadryl cream, we should clean the affected area with soap and water and gently pat dry it. Apply Benadryl cream to the affected area as directed. So don't use more than 3 or 4 times a day. Wash your hands after using the Benadryl cream. The next atopic eczema product is Fussibet cream. Apply a thin layer of cream to completely cover the affected areas. Use it twice daily. This cream should not be covered with bandages or other coverings after applied. Okay, the last atopic eczema product is Dermovate. Apply the Dermovate cream sparingly to cover the affected area and gently rub into the skin. Use the Dermovate cream 2 to 3 times daily. The total dose applied should not be more than 50 grams in a week. This is the reference that I've used for my assignment. That's all from me, madam. Thank you.